Let's explore the key landmarks visible on IOPA. The key to accurate diagnosis lies in reading these vital IOPA landmarks. First, let's understand why some structures appear radiopaque and the other appears radiolucent. Materials which are dense and have high mineral content, they absorb or block the X-rays, thus preventing the X-rays from passing through completely, thus creating the brighter areas on the film. For example, the radio-opaque structures are enamel, dentine, bone, and the metal restorations like amalgam or gold. Materials which are less dense, they allow the X-rays to pass through them easily, so more the X-rays reaches the detector and produces the darker images. For example, the soft tissues, air spaces, the dental pulp, and the caries, they appear darker, that is, they appear radiolucent on an IOPA. This radiopaque structure is enamel. Since enamel is 96% mineral, it prevents the X-rays from passing through completely, thus appears radiopaque. Then comes the dentine. Dentine is almost 75% mineralized, but because of its lower content, its radio density is similar to that of the bone and is less radiopaque than enamel. Cementum is not usually visible radiographically because the contrast between cementum and dentine is so low and the cementum layer is very thin. This radiolucent structure is pulp. Since pulp is composed of soft tissues, it allows the X-rays to pass through them easily, so it appears radiolucent. This thin radiopaque line is lamina dura, or the hard layer. It lines the tooth socket surrounding the root of the tooth. On a dental X-rays, it appears radiopaque line bordering the root. This radiolucent structure between the lamina dura and the tooth root is pedial space. Since it is made up primarily of the collagen, it appears radiolucent because it allows the X-rays to pass through them easily. This is alveolar crest. The gingival margin of the alveolar process that extends between the teeth appears radiopaque because it's a bone structure, it's mineralized, so it appears radiopaque. It doesn't allow the X-rays to pass through them easily. I will provide the list of radiolucent and the radiopaque structures at the end of the video. This is a developing root that is shown by a divergent apex around the dental papilla, which is enclosed by an opaque bony crypt. This is radiopaque bony crypt. Let's see what all structures are visible on maxillary central incisor IOPA. This thin radiolucent line is intermaxillary suture. It appears in the midline of the maxilla. This is anterior nasal spine, which appears radiopaque. It's a V-shaped projection from the floor of the nasal aperture in the midline. This is the anterior floor of the nasal aperture. This is incisive foramen. It appears as an ovoid radiolucency between the roots of the central incisor. This is a maxillary molar IOPA. This radiopaque line is the inferior border of the maxillary sinus. It appears as a thin radiopaque line near the apices of the maxillary premolars and molars. This is maxillary canine IOPA. So this structure is inverted Y line of anus. It is formed by the anterior border of the maxillary sinus and the floor of the nasal fossa. Inverted Y line of anus formed by the border of the maxillary sinus and the floor of the nasal fossa. This is again a maxillary molar IOPA. This structure is zygomatic process of maxilla, which protrudes laterally from the maxillary wall. This is a mandibular premolar IOPA. This radiolucent structure is mental foramen. It appears as an oval radiolucency near the apex of the second premolar. This is the mandibular molar IOPA. This radiopaque structure is mylohyoid ridge running at the level of the molar apices above the inferior alveolar canal. This is again a mandibular molar IOPA. This is the inferior alveolar canal. This is the radio-opaque superior border and this is the inferior cortical border. This is the mandibular central incisor IOPA. The nutrient canals are visible. These are the vertical radiolucent structure. They are visible more frequently in patients with the high blood pressure, diabetes, and the advanced periodontal diseases. As promised, this is the list of the radiopaque and the radiolucent structures and the materials that are used in dentistry.